All right, guys, hold on for 1 second because there's breaking news up in the Senate as well.
It's no longer just unacceptable, the healthcare system. It's unsustainable. We cannot continue.
He's the acting chairman of this committee that's dealing with healthcare reform. And just a few moments ago, they passed this healthcare reform. You see a vote 13-10 in favor. Let's listen in briefly to Chris Dobb.
That makes us bring together the synergy and the opportunity to do what every other Congress and every other administration has been unable to achieve for almost 7 decades. We're determined that that will not happen on our watch. With that, let me turn to Senator Harkin and the rest of my colleagues. Tom?
Well, first of all, Mr. Chairman, thank you very much for your great leadership on getting us over the finish line. It's been a long slog, but we all worked hard. We all stuck together. And what we now have is a bill that does 4 things. It reduces costs, it protects choice, it assures coverage for all Americans, and it also begins to change our system to be a health care system rather than just a sick care system. As President Obama has said many times, that prevention and wellness and public health is the one way that we're going to change the system so that we can keep costs down in the future. And in this bill, we have made great strides forward in putting more emphasis on prevention, keeping people healthy in the first place, and keeping them out of the hospital. And so I think this is a good bill for America. It is the right prescription for what ails this country right now. And I want to thank all my colleagues for all of the great work they did and sitting here through all these long hours and drafting a bill that I believe now will garner a lot of support in the Senate, and I believe we'll get it over the finish line sometime this fall, and we're going to have this on the President's desk sometime early this fall.
All right, so the Senate has, at least the key Senate committee, has passed legislation for major health care reform. Similar action has been done on the House side, although very different in terms of raising taxes on wealthier Americans. Eventually, at some point, if, in fact, a Senate version does emerge and a House version emerges, different versions, they're going to have to reconcile those 2 versions and come up with something that both houses can then send to the President of the United States for his signature. That is a lot easier said than done. Dana Bash is our senior congressional correspondent up on the Hill. Huge differences between the House version, the tax increases there, and the Senate version, missing some of those huge tax increases.
That's right. Those are some of the huge differences. But I think the key thing that our viewers need to understand is that certainly this is something that is worth noting, and it is incredibly important to these senators who have been working day in and day out for weeks and weeks on this specific committee, the so-called HELP committee, to pass this legislation. But there is another committee, the Senate Finance Committee, that really is the one that is going to make this happen. This, if you notice, this passed by 13-10. Really along party lines. And this other committee, the Senate Finance Committee, led by Max Baucus of the state of Montana, and also on the Republican side, Charles Grassley of Iowa, they are the ones the White House knows, the Democratic leadership knows, pretty much everybody on all sides of Capitol Hill. They are the ones that are ultimately probably going to determine what exactly this health care reform bill looks like. And they are working also day in and day out, and they might come up with something in the next couple of days even, we're told, through this committee. So that is certainly the place we are going to look for. It doesn't take away the fact that Democrats can certainly speak proudly about the fact that they have made some progress finally on this issue, which has been taking a very long time. But this is probably something that we should be looking ahead towards, especially since the fact that this committee isn't really where the action is going to be ultimately.
Dana, stand by.